here in the capital city of Berlin at the annual European Congress of Rheumatology, the 8-year results of the BEST trial that assesses functional ability in rheumatoid arthritis were presented.
And we've seen from the very early beginning that there's a difference depending on how you start treatment. If you start with combination therapy, patients will respond much more early, and it means they will have earlier functional improvement. And in the long term, there's an additional benefit that the patients who have started with the initial combination therapy have less radiological damage progression. And it stays clinically relevant, or statistically relevant for up to 7 years or so. But now we are looking into the longer follow-up phases of the study. We see that the initial differences are sort of washed away or diluted by the fact that we're constantly tweaking and tuning the medication in order to get patients below 2.4. And we achieved that for a vast majority, up to 80% of patients who are in that trial. And it means that these patients have a persistent improvement in functional ability that was achieved in the first year, and then they're keeping that level of functional ability over time. And that's unique in this trial because in all the cohorts you see a gradual deterioration in function. And that is because they have deterioration of function due to damage progression. And in the BEST study there is hardly any damage progression year after year because the disease activity is low. So this is a unique finding as a proof of treating to target, persistently aiming at low disease activity, is going to pay off for patients. It's keeping them functionally able and able to do their normal activities.
Can you also tell me why is it tapering to a drug-free state important?
We don't know whether it's important. I think it's psychologically important in the first place. For me, it's looking at rheumatoid arthritis as a different type of disease. It's always known as a chronic disease that needed chronic treatment. And now we're looking at a disease that if you're very successful in suppressing the disease activity, then some patients at least go into a state of such low disease activity that they can come off of treatment. And it means that it's not a chronic disease anymore, potentially.
This has been Damien McNamara reporting from Berlin.